Hello, so this is how to check for breast cancer. Breast self-exam or regular examining your breasts on your own can be an important way to find a breast cancer early, when it's more likely to be treated successfully. While no single test can detect all breast cancers early, BreastCancer.org believes that performing breast self-exams in combination with other screening methods can increase the odds of early detection. Over the years, there has been some debate over how valuable self-breast exam really is in detecting breast cancer early and increasing the likelihood for survival. For example, a 2008 study of nearly 400,000 women in Russia and China reported that breast self-examination does not have a meaningful impact on breast cancer survival rates. It may even cause harm by promoting unnecessary biopsies. Because of the ongoing uncertainty raised by this and other studies, the American Cancer Society no longer recommends breast self-examinations as a screening tool for women with an average risk of breast cancer. I still believe that breast self-examination is a useful and important screening tool, especially when used in combination with regular physical exams by a doctor. Mammography, and in some cases ultrasound and/or MRI. Each of these screening tools works in a different way and has strengths and weaknesses. Breast self-exam is a convenient, no-cost tool that you can use on a regular basis and at any age. I recommend that all women routinely perform breast self-exams as part of their overall breast cancer screening strategy. So how to do a breast self-exam, the 5 steps. Begin by looking at your breasts in the mirror with your shoulders straight and your arms on your hips. Here's what you should look for. Breasts that are their usual size, shape, color. Breasts that are unevenly shaped without visible distortion or swelling. If you see any of the following changes, bring them up to your doctor's attention. So dimpling, puckering, or bulging of the skin, a nipple that has changed position or an inverted nipple, redness, soreness, rash, or swelling. Step 2, now raise your arms and look for the same changes. Step 3, while you're in the mirror, look for any signs of fluid coming out of one or both nipples. This could be a watery, milky, or yellow fluid or blood. Step 4, next, feel your breast while lying down, using your right hand to feel your left breast, and then your left hand to feel your right breast. Use a firm, smooth touch with the first few finger pads of your hand, keeping the fingers flat and together. Use a circular motion about the size of a quarter. Cover the entire breast from top to bottom, side to side, from your collarbone to the top of your abdomen, and from your armpit to your cleavage. Follow a pattern to be sure that you cover the whole breast. You can begin at the nipple, moving in larger circles until you reach the outer edge of the breast. You can also move your fingers up and down vertically in rows as if you were mowing a lawn. This up and down approach seems to work best for most women. Be sure to feel the tissue, all the tissue, from the front to the back of your breast. For the skin and tissue just beneath, use lighter pressure. Use medium pressure for tissue in the middle of your breast, and use firmer pressure for the deep tissue in the back. When you reach the deep tissue, you should be able to feel down to your rib cage. Step 5, finally feel your breast while you are standing or sitting. Many women find that the easiest way to feel their breast is when their skin is wet and slippery. So they like to do this step in the shower. Cover your entire breast using the same movements described in step 4. So what to do if you find a lump? Don't panic if you think you feel a lump in your breast. Most women have some lumps or lumpy areas in their breasts all the time. And most breast lumps turn out to be benign, so not cancer. There are a number of possible causes of non-cancerous breast lumps, including normal hormonal changes, a benign breast condition, or an injury. Don't hesitate to call your doctor if you've noticed a lump or other breast change that is new and worrisome. This is especially true for changes that last more than one full menstrual cycle, or seem to get bigger or more prominent in some way. And also, you need to know what to expect and make sure you get your answers. So, thank you for listening.